The Reforms Task Force report by the county indicates that respiratory diseases account for 60% of outpatient visits, while diarrhea diseases account for 16% of the visits. And as Gloria Milimo now reports, the team of experts are now calling for reduced disease burden in a bid to ensure a healthy population.
Nairobi County remains among counties grappling with both communicable and non-communicable diseases. Despite progress being made to ensure a healthy population in the last decade, the health profile of the capital city, said to be home to over 4 million people, remains worrying. Experts say the situation requires urgent attention to ensure the well-being of the residents.
We also know that Nairobi is a highly urbanized city. And right now, the burden of disease in Nairobi is changing. And we are seeing more and more of what we call cardiovascular diseases. Diseases that are derived from lifestyle, hypertension, diabetes.
According to a Health Reforms Task Force report, some of the top 10 diseases affecting children under the age of 5 include diseases of the respiratory system, diarrheal diseases, skin diseases, pneumonia, malaria, urinary tract infections, typhoid, and accidents. Similarly, causes of morbidity among those above the age of 5 include ear infection, dental disorders, and all the top 5 diseases affecting children under 5. Respiratory diseases, according to the January 2023 report, accounted for 60% of outpatient services, while diarrheal diseases, often associated with sanitation and hygiene levels, accounted for 16% of the same visits. The team of experts attributed these diseases to factors such as air pollution, congested and poorly ventilated dwellings, poor drinking water quality, sanitation and hygiene, among others.
We have to also ensure that we focus on reorganizing, reviewing public environmental health and water and sanitation and hygiene services, including the legal framework to support it. That if we want to have bylaws to ensure that people don't dispose waste so they put others in danger, that the environment is well maintained, that we don't have people who are disobeying anti-smoking regulations inside public places, then we have the framework, the legal framework, to enforce it. Then we ensure that we reduce the disease burden.
Non-communicable diseases like cancers in the city are said to be compounded by lifestyle and inter-county movement of people with other underlying conditions that raise the county's disease burden. For now, residents of Nairobi can only hope that the findings and recommendations by the task force will help improve its health indicators